And so will the scope of orthopedics further increase? As long as there is a creativity, as long as there is an innovation exist in this department, I think the scope of orthopedics will always increase. So what about creativity and innovation? And it is not only true for orthopedics, for that matter, it holds true for any other department. So hope you all guys agree with it. So is there any creativity? Is there any innovation happening in the department of orthopedics? I would say yes. Come on, guys. We started operating with the robots much ahead of many other departments. Robotic system and navigation system are in orthopedics for close to 20 years now, and we are producing great results with the help of robotics and navigation. To be honest, orthopedics is one of the department or one of the earliest department to embrace other culture, for example, engineering, technology, nanotechnology, and other things. And we started evolving along with other discipline of science like physics, chemistry, and other things, right? So robotics is one such classical example. And look at that guy, and that's me in Melbourne. So this is a mixed reality and virtual reality. And ever since the virtual reality come into the picture, I think orthopedic specialty is the first specialty to embrace the mixed reality, in which in this video, can you see, I'm taking, I do a 3D modeling of a scapula of a patient and then put the scapula in the operating table. Thereby, I can practice my own surgery even before starting operating on the patient. And when I want to do the surgery onto the patient, I will position the same scapula, what I had designed, into the actual scapula of the patient after exposure. And then I'll take my cuts, I will take my guide pin entry, and I will put my trajectory as according to my plan. So, in order to give the best and efficient care, we are the one who started accepting the creativity of other discipline of science. So I think the scope is increasing. I hope you guys won't disagree with my statement. And the PSI, and just for the sake of this seminar, I got a few models from my surgery, what I did last week. So can you all see this? So this is basically a 3D printed femur. Okay, so previously we have like a big tray set comes to you, and the tray set is like a fixed tray set for every total knee replacement, and you have only some linear adjustment which you can make, like whether you want a 2-degree valgus or 3-degree valgus or varus, and how you want to correct the angular deformity, how you want to correct the sagittal deformity, and things like that, right? So it's like a fixed instrumentation. But now what we do here is we print the actual femur of the patient, right? And we plan how we are going to do the surgery, and we do the surgery virtually. And we will ask the computer, the computer-aided designing, to run the range of movement assessment and to tell. So if I make the cut in femur this way, can you see small lines in this femur, what I have marked? So if I cut the femur at this level and put the implant as according to the plan, how would be the range of movement post-operatively? So I can predict the range of movement using the artificial intelligence and data computations. And, so once I'm happy with my cut, then I will design a jig to make the cut, accurate. And for example, I made this jig for that patient, and which exactly fits into femur like that. So this is what called as PSI, a patient-specific instrumentation. Can you see? So once I designed this jig, then during the procedure, I will take this jig and put it in the right on the patient's femur, and then I will take a cut. So now I don't need to rely on a fixed instrumentation. Rather, I will make my own instrumentation to take the femur cut in case of a total knee replacement. And this is my tibia, and that's the tibial cut, what I was planning, right? So this is what called as a patient-specific instrumentation. So you can practice your surgery in a 3D model, and you can plan the range of movement. You can, well ahead analyze how much would be the range of movement in the patient when they undergo the surgery. And based on that, you can modify the instrumentation right ahead of time and then give the best outcome to the patient. Is it not innovation and creativity to a greater extent in the field of orthopedics, especially in the last 5 to 10 years? I should say orthopedics is growing the growth rate, that the projectile is too steep, and it is embracing a lot of other technology, and the creativity is phenomenal. And look into this patient, like, can you see here, there is a tumor in the pelvis, and they want to, they printed the 3D pelvis in it, and then they create a 3D printed implant, which is biocompatible, and then replace the whole part which was affected with the tumor. Think about, like 30 years or 40 years back, if the same patient with the same tumor, and if it tend to have some aggressive potential, these people would end up in having a big amputation involving the pelvis. But now you are saving now the surgery has become more of a limb salvage. And look into the other tumor here, and this tumor is affecting the metaphysis, but the epiphysis is spared. And when I'm sure that it doesn't have any satellite lesion, and I can use the computer-aided designing and can prepare my own custom implant for this patient, all it's sitting in the system, right in front of the system, and ask their company guys to just create what I have planned. And by this, I haven't even lost the joint. Leave amputation. Amputation is so outdated now, and now we are not even we are trying to spare even the joint affected and make sure the patient is having good range of movement as well, right? So that's about the innovation in orthopedics. And CT navigation feedback, and when you're putting a screw in a spinal cord, especially through the pedicle process, you don't want to damage any precious and important structure nearby. So the CT guided navigation feedback would tell you, oh, come on, doctor, you need to increase your projectile. Your trajectory is right or wrong, or your entry point is right or wrong. These navigation and the feedback mechanisms were not there like 20 years back, but now we have innovated. So there are heaps of scope, and there are numerous examples available for us to say the scope of orthopedics is ever increasing. And orthobiologicals, last but not the least, now people, no one wants surgery. If they can avoid, everyone wants to avoid surgery, right? It takes a lot of pressure for the patient to decide to put themselves under your knife, to go asleep without conscious under the gases of anesthetics, right? So it is a big decision sometimes. So if you can do something to avoid a surgery, obviously we will try our level best, right? And so one specialty which is coming up highly these days is the PRP therapy and other orthobiologics to help with the healing process, especially with the degenerative changes. But remember, be sensible, okay? A lot of orthopedic problem, including the arthritis and several other problems of orthopedics, is more of mechanical problem. When you are having a mechanical problem, treat the mechanical problem in a mechanical way, right? But when the problem is chemical, you want to treat it in a chemical way. When the problem is the biological, you want to treat it in the biological way. So in that way, orthobiology has become a pillar of treatment management when it comes to orthopedic practice. But I won't say that it is going to replace the whole of orthopedics now. Right. That's why I'm telling every single subspecialty and every single innovation in orthopedics has its own potential to stand alone and withstand the time crisis and to win over. Right. So I feel orthobiologics is of great potential and value to manage a lot of degenerative problems, but may not be of great help when it comes to deformity. I think still surgery holds the key. And think about 3D cellular printing. When there is a rotator cuff, the biology is now, was completely buggered and trashed. And in that case, all you need, even if you're trying to do the surgery, when the biology is not intact, when the tissue has already been aged, I don't think the rotator cuff is going to heal, or the ligaments or the tendon, when they are having a precarious blood flow, I don't think they will heal well simply with the surgery. In that case, think like if the current innovation system can help us making an artificial rotator cuff with the help of 3D cellular printing and add some tenocytes into these printed models, and then these tenocytes started growing some tendon and things like that, that would be great, right? So that is about the 3D cellular printing and things, which is coming up highly. So this is actually from an journal article published. So authors and scientists are now preparing the printing modules on which you can add the biology. So thereby you will have the conductive principle and the inductive and the genetic potential in a patch of an artificial synthetic thing. So that's phenomenal. AI. Now, in several countries, after a patient getting a total knee replacement and things like that, the patient will given an Apple Watch or something like that to monitor the range of movement, the number of steps. So by embracing the data from the patient, this helps us to diagnose a condition, helps us manage the condition, give them the best rehab potential. And also these data can form like a collective pool, thereby we can do a quality research and do a great systematic analysis. So the data and artificial intelligence in the orthopedics is growing and evolving. I think it's going to rule orthopedics very soon.